So I had had COVID previously, and it hit me really hard. The whole 9 yards, hospital, rehab afterwards. So with all of that ordeal, I was really concerned about the side effects. I thought to myself, I've had COVID, I'm worried about the side effects, how it's going to interact with my body, how the side effects are going to affect my comorbidities, and also with all the long COVID symptoms that I was struggling with. I thought to myself, these side effects could also just cause havoc, more havoc. So I was really concerned, I was scared, basically.
So what then changed your mind and made you decide to get vaccinated?
So, my friends, my colleagues, my family started taking the vaccine, and everyone was so open about, the side effects, the process. There wasn't really a huge conspiracy or any, fearful things that happened after they had taken the vaccine. So then I thought to myself, maybe it's not so bad. But I think for me, the cherry on top was my daughter saying, if Granny can take it, why can't you? And my mom is a 68-year-old healthcare worker. She took it in the morning, and then, in the afternoon, she had her shift and she went back to work. And she didn't have any side effects. So that really pushed me, and I thought to myself, okay, let me try, let me actually go and confront my fears.
So tell us about your vaccination, which vaccine did you take, and did you have any side effects?
I took the Johnson & Johnson vaccine. I prepared myself. I took it on Friday thinking I was going to, have all these side effects over the weekend. But surprisingly, yes, I was tired. My arm was painful. I took some Panado, but I was fine. By Sunday, I was up and about. So yeah, it was a bit of an anticlimax.
So Kanya, if I have to talk to a family member who is a bit vaccine hesitant, how should I talk to them? What worked for you? What were the aspects that worked?
So I think the most important thing is empathy. You've got to really put yourself in people's shoes, because people are scared. So don't dismiss their fears. I think people are really scared about the side effects. It's the fear of the unknown. So arm yourself with information to be able to deal with it. Don't dismiss them as crazy. And I have a lot of family members, friends who are still grappling with all of that. So my experience is not unusual. But I think the main thing is empathy.